Buenas tardes otra vez. Vamos a iniciar esta mesa redonda.
Good afternoon again. We're going to open this panel discussion with experts in direct teaching of fertility awareness, and people that are working at different hospitals, and people that have lots of experience in relation to their own academic training and their clinical work. And I would like to thank the organizers very much indeed for inviting us. And without further ado, we're going to move on to this panel discussion. So please, speakers, please finish on time, will you? Well, as the moderator of this panel, I would also like to thank the organizers for having invited me to participate, and on this great day we've had where the health sciences have provided us with the physiological foundations as well as the recognition of fertility. Now what we have to do is say that sometimes it could be difficult with these current teaching methods, or with the teaching methodology, which is what we're going to be looking into now, and also in our technological world and in our current world, where everything is based on IT and on new technologies. These new technologies have made a very significant contribution towards teaching and fertility awareness. And we're going to have the first speaker, Eva Corujo, who has a degree in pharmacy by the Complutense University of Madrid. She has a master's degree in bioethics by the Rey Juan Carlos I University of Madrid, and she's an expert in fertility awareness. She's a monitor of the syntothermic method, or syntothermal method, and she's also a specialist in affective and sexual disorders. And she's currently working at Letyourselves, I think she said, in the field of education and in disseminating natural systems for couples. So, Eva, you have the floor. Okay, well, thank you very much. The first thing, well, thanks to the organization, thanks to the organizers for having invited me for having offered me the opportunity to talk about the Billings Method. And secondly, I would like to thank the association in Spain, which is the one I belong to. It's the Billings Ovulation Method. Thanks for trusting me and for allowing me to talk about this method. I've always believed that without Dr. Billings, I don't know what would have happened. History would have changed quite a lot. And with this presentation, what I want to do is talk to you about where's the remote control? It's right there. What I want to do is talk to you about the path followed by both doctors, Billings, in terms of cervical secretion, and everybody is familiar with this, everybody knows about this, but there was a time when this was very unknown. And I was going to briefly explain the Billings Ovulation Method, or BOM, how it works and how we teach it to women and their spouses. And lastly, I would like to talk about the association I'm a member of that is associated with Womb International. And this started in 1953 when John Billings, a neurologist from Melbourne in Australia, bumped into a friend of his, Father Caterini, and asked for help for those women that wanted to manage their fertility in a natural manner. And the only thing that existed then was temperature and rhythm. Well, we all know that temperature is insufficient to detect the complete fertility window, or the beginning of it. It was unknown. And well, as far as rhythm is concerned, we also know that it fails a lot. And what Dr. Billings wanted to do was find something that was easy, so that any woman could be able to interpret her cycles in an easy manner. So he looked this up in the medical literature, and this had already been described 100 years ago. They described cervical secretion or cervical mucus, but very little was known, because it wasn't known to the extent to which extent this could influence fertility. And he studied it and discovered that cervical mucus could be one of the major indicators for fertility, not only of ovulation, but of the entire fertility window. And I didn't mention this before, but all of the pictures that appear here have been taken from the archives of the association. These are different symposia where Doctors Billings appeared. That is John and Evelyn Billings, his wife, who also helped in the research. When he suspected that cervical mucus was closely related to secretion, what they did was start a clinical study. In other words, they focused on those women so that they could carry out a very careful register of their sensations with cervical mucus throughout the cycle. So it was both sensations and mucus. And Evelyn had played a key role because she taught lots of women. She did woman-to-woman training, and it was very effective for a woman to explain to another woman what could happen during the cycle. So very big importance was given to that sensation and to the mucus and its appearance. Well, it's fundamental to carry a register, a constant register. So all of these assumptions that they had, that Dr. Billings had, as regards the fact that mucus was closely related to fertility, was materialized when they met James Brown, who was another expert doctor and who worked in the field of hormonal medicine for women's cycles, and who correlated what women perceived throughout the cycle. In other words, all of those things that they registered on or they recorded on the charts. And let's say that this is where this correlation appeared, and it was confirmed that when the estrogens went up, the window changed. And well, let's say that this is what happened generally speaking. But in any case, it was very important because James Brown did more than 750,000 hormonal studies that serve as a basis for the formula used, and it was a very important step. But what you can see in this picture, these are the typical colors of the Billings ovulation method. And thanks to all of these hormonal measurements and with these women's registers, it was concluded that this characteristic feeling or sensation of slipperiness, this fertile mucosa, was related to fertility. So the method did confirm that direct correlation of the hormones, or with the hormones, but the research didn't end here. And it was a little bit later on when they started to teach women there in Australia, which is where they were born in 1968. This extended throughout the rest of the world. These teachings reached out to the rest of the world, and in the 70s, it's when they met Eric Odelblad. And all of us that work in this field is very well known. So everybody knows who Odelblad is. And at that time, well, they didn't know each other, but people were not aware of his research. He studied cervical function, in other words, how the cervical mucus operated and the transport of sperm and sperm survival. So in other words, the fertility window. He also defined what is known as the peak day, the most probable ovulation day. So what Billings research, together with what they had discussed with Dr. Brown, became scientifically significant when they saw that Odelblad, with those samplings of cervical secretion, everything was correlated, not only the hormones and what women noted on the charts, but also the rest of the patterns that were perceived by women through the observations of their sensations and secretions. In 1972, that's when the scientific foundations of the Billings ovulation method were published, with a highly demonstrated efficacy thanks to this woman-to-woman teaching, and now thanks to the Woomb Spain Association, but internationally this is a method that has released the basis, but it's a method that has now reached the rest of the world, and it's very efficacious. And the rules, it's only 4 basic rules that the method has that are very solid with all of the research that was done, and it turned out to be a very safe and reliable method, easy to use at all moments of reproductive the reproductive cycle, and it considered that vulvar sensation was one of the most important parameters. And it's a method, really, a method that can be learned by any woman, so you don't need to have any specific studies to understand it. Even though there's a very scientific base that supports it, it's accessible to any woman. It's very easy to learn. The methodology we use is very straightforward too. In other words, what we usually recommend is that there be somebody, an instructor, that does carry out that learning, that deals with the learning of that woman or that couple, so that women can start to recognize these signals in their bodies, and we do so through what we call initial instruction that has been recently approved in the institution at Womb International, where we explain women the scientific base in a very straightforward manner, because the idea is not to give them an in-depth class of biology, but rather that they learn to understand themselves, and the cycle stages are also described in the 4 basic rules. And of course, each woman is a world, and teaching is adapted to each one of them, depending on their situation. It's not the same thing in postpartum or breastfeeding, in normal cycles, or with stress or irregular cycles. So when we contact with a woman, we always draw up a clinical record to see what her status is. And this continuous monitoring is very important with charts, because many times people ask if they can do that on their own. Yes, but it's very good to have the support of somebody that helps you solve those doubts. Normally, well, from 3 to 6 cycles. With 3 to 6 cycles, those users are pretty autonomous. But at the beginning, many doubts could arise. If is the pattern the right one? Am I doing the observations well? If the register, is it okay? And what I said before is that, well, we have all of those sensations that occur in the vulva, where you can perceive the secretions that come from the neck of the uterus. And in a very straightforward manner, we ask the women, well, we ask them to observe those sensations they have during the day, during their daily activities. And we know that the neck of the uterus changes. It is highly reactive to the growing levels of estrogens. So women's observations end up being pretty straightforward for them. And that's how they get the key factors to detect that beginning of the fertility window. And the 2 questions they have to ask is, what do I feel and what do I see? Every day they take note of their own words, well, in 1 or 2 words, something that's very objective, something that is not at all complex. And we use a very straightforward system, coloring standard. Red corresponds to menstruation, green and yellow correspond to infertility patterns, and these little babies, possible days of fertility. X, a baby with an X, would be a peak, and then in the rest of the post-ovulatory stage, well, you get yellow or green indistinctly. And these are the fertility patterns, which are absolutely crucial for women to learn to identify their cycles. Each one has their own fertility and infertility patterns, and these are the 4 rules that I said before that are always going to be the same ones. And these pictures are 2 pictures with user charts that are real charts. I'll show you now the mobile apps we use for these people. In the beginning, it might be a little bit difficult. Well, that happens with any method. It's difficult if you've never done it before, but little by little, and in that learning period, what they do notice that at the end, it becomes an instinctive act. And it's something that you use every day with the help of the instructor. That is extremely useful. But what we have at the disposal of users, apart from materials that they can get through the website, we also have charts on paper or charts that can be downloaded, like Excel spreadsheets. We also have mobile apps and fertility pinpoint and fertility charting, I think she said, fertility pinpoint and NFP charting, sorry. And then we have another system created by Mexican researchers, and these are very comfortable because these are mobile apps that allow users to be connected to their instructors. There are both men and women instructors. So this is a very comfortable manner. Well, if these women have any doubts or if they need a revision, they have at their disposal somebody that can give them a hand for the method to be efficacious. But when we talk about efficaciousness rather, you have to give lots of importance to this, especially when you use a natural method. And I'm talking about this method, but well, we give lots of importance to the motivation of the woman. This daily register is very important. And then 2 minutes, please, and also the collaboration of the partner. Because in the first tests that were run, when we started to analyze the method, the pregnancy rates were very low, between 0 and 4%. And when the method was improved, it was fine-tuned, and they reached an effectiveness of nearly 100%. And to achieve pregnancies, there's a study that is called, the most recent one is called Human Fertility of 2019. It's an Australian study on pregnancies achieved that included lots of couples with fertility problems and women over 35. Well, efficacy, in 2 years, 63% of pregnancies were achieved, and that's a very good percentage. What are the advantages? Just to summarize what we have been seeing in all of these sessions over the symposium as regards sexuality. Well, I'm not going to talk about all of the health benefits because they are plenty, but just to say something about how important it is to use a natural method in collaboration with the partner to establish a constructive collaboration so that they can become much more effective in terms of sexuality. Natural methods favor that communication in a married couple. And the Billings Method, I said before, is all over the world right now, and it can be found in 5 continents and in more than 60 countries. And this picture you can see here is the picture of the conference we're going to hold in the month of October in Colombia. And it takes place every 3 years, and it's an international event, the organization. This womb association was established by Drs. Billings. They have 5 directors who are currently in charge of the association Woomb Spain, which is the association that I belong to, which is under the umbrella of Woomb International. We have instructors in all provinces. And to finish, well, just say that we are focused on research and training. We train not only users but also instructors. And well, if you go to the website, you have access. If there's anybody who wants to have a look, the chairperson is Eva Muñiz, who's moderating the panel, by the way. And that's it. That's it. That's my lot. That's my bit. Thank you.